I'm Emily McAllister, and I'm a registered dietitian with NCHPAD. You're probably watching this video because you or a loved one has been diagnosed with type 2 diabetes, and you want to figure out the best way to manage it. The Mediterranean diet has been extensively studied in relation to type 2 diabetes. Researchers actually began observing lifestyles in different countries back in the 1950s. And found that people that lived in the countries surrounding the Mediterranean Sea were healthier than those that live in Western nations. Since then, research consistently shows that this diet is beneficial to both preventing and managing type 2 diabetes. So, what is the Mediterranean diet? The Mediterranean diet emphasizes whole, minimally processed foods that includes fruits, vegetables, nuts, seeds, legumes, whole grains, fish, and olive oil. Higher consumption of whole foods help to prevent those spikes and crashes in blood sugar levels. In order to manage your blood sugars, you need to monitor your carbohydrate intake and the types of carbs that you consume. So now let's talk a little about carb counting. 15 grams of carbs is 1 carb serving. Some examples of 1 carb serving includes 1 slice of bread, 1 6-inch flour tortilla, a 1/3 cup of rice, a 1/2 cup of sweet potato, a small apple, and 1 cup of strawberries. So let's say you eat a turkey and cheese sandwich with 1 cup of strawberries. That will give you 3 carb servings. You're getting 2 carb servings from the sandwich and 1 carb serving from the cup of strawberries. When it comes to choosing carbs, you need to understand the difference between complex carbs and simple carbs. Complex carbs, such as fruits, vegetables, whole grains, and legumes, are key when choosing your carbs because they provide vitamins, minerals, and fiber. Simple carbs, such as candy, soda, baked goods, sugary cereal, and fried foods, are higher in added sugars and refined carbs, causing those rapid spikes in blood sugars. These give carbs a bad rap, but choosing more complex carbs while limiting simple carbs is beneficial to managing your blood sugars and overall health. Complex carbs include starchy and non-starchy vegetables. Starchy vegetables such as potatoes, peas, and carrots need to be an appropriate serving size because the starch can raise your blood sugar. Non-starchy vegetables such as broccoli, cauliflower, and leafy greens are what we want to load our plates up with because they have very little effect on blood sugar and they have antioxidants which help repair damaged cells. The Mediterranean diet also manages blood sugar by promoting balanced meals. A balanced meal looks like having a good source of protein, a healthy fat, some complex carbs, and a lot of non-starchy vegetables. Pairing carbs with protein and healthy fats also contribute to lower blood sugar levels versus eating a carb by itself. Managing type 2 diabetes can seem overwhelming at times, but you can begin a healthier lifestyle with small steps. Start by just focusing on high fiber foods that you can implement into your daily diet. If you like eggs, make a vegetable omelet. Incorporate nuts and fruits for your snacks. Add a cup of non-starchy vegetables to your lunch or dinner. Although diet plays a huge role in managing type 2 diabetes, there are other factors to consider, such as being active and managing stress. I hope you find practical ways to implement healthy eating habits to help manage your type 2 diabetes and improve your overall health. If you like this video, feel free to like, comment, or subscribe.